What if I told you that the project teams consistently outperforming aren't working harder, they're working differently? Hi, I'm Miss Brown, and today we're talking about how adopting Agile Project Management in your clinical trials can change the way you work, the way your team collaborates, and ultimately, the way your studies perform. Do you know that according to the 17th Annual State of Agile Report, 71% of organizations now use Agile in their workflows? Pharma is already in that wave. Agile mindset can help you resolve issues more efficiently, avoid project delays, and maximize team collaboration. Let's discuss a practical, clinical trial-specific guide to applying Agile mindset to the work you're already doing. Let's get into it. Agile is an adaptive way of working. Individuals over processes, working results over documentation, customer collaboration over contracts, and the big one, responding to change over following a fixed plan. The Agile Manifesto has 4 values, and I want you to hear them through a clinical trial lens. Agile in clinical trials means catching a site activation delay in 48 hours, not weeks. It means adjusting to a protocol amendment without losing a month, delivering value continuously, not just at database lock. Monthly governance calls and quarterly risk reviews, that's Waterfall methodology. What is Jira? It is an Agile tool created by Atlassian. 62% of Agile teams globally use Atlassian Jira as their primary tool. Jira maps study startup, site management, vendor oversight, risk management, closeout. Every activity becomes a ticket with an owner and a status. No more chasing action items in email threads. And for backlog prioritization, use Moscow. Patient safety is always must-have. Site query resolution is should-have. The non-urgent dashboard refresh won't have this sprint. Simple, clear, and respected by your team. The clinical trials market is now valued at over $81 billion globally and growing at nearly 6.5% annually, with digitalization of trial operations cited as a primary growth driver. Agile-enabled digital working is the direction of travel. Here is the timeline on this slide. From protocol design through to closeout, Agile practices apply at every stage. During startup, sprint planning keeps your regulatory submissions on track, and your Jira board shows activation status per country in real time. During maintenance, your 2-week sprint cycle aligns with your monitoring visit cadence. During closeout, your TMF reconciliation checklist becomes a sprint board. Every phase, every deliverable, tracked and visible. Let's go over Agile rituals. Daily stand-ups keep the team aligned. The daily stand-up is not a status meeting. It's a blocker detection system. 15 minutes, 3 questions. What's done? What's next? What's stuck? That last question is where the gold is. For example, a regulatory query left unaddressed for 48 hours can delay approval by weeks. Sprint planning, typically every 2 to 4 weeks, gives your team a focused, agreed goal. For example, a site activation goal that can be tracked daily. And retrospectives, the most underused tool, where you actually learn and plan for future mitigation. Not just what went wrong, but what will you change next time, and who owns that change? The FDA said it clearly in 2013. Risk should be identified early, monitored continuously, and escalated based on signals, not schedules. That's exactly what Agile enables. And yet, the reality in most trials is closer to the before Agile column I have listed here. Issues flagged at monthly reviews alone. Sites inactive for weeks before anyone notices. Risk logs updated only quarterly. Escalation taking 2 weeks via email chains that spiral out of control. The PwC analysis of Agile adoption found that organizations using Agile are twice as likely to succeed on their projects compared to traditional waterfall approaches, and 50% more likely to meet their deadlines and budgets. In clinical trials, those are not abstract statistics. With Agile risk, identification can be done following 5 simple steps: identify, log, assign, mitigate, review. And it's what separates reactive trial management from genuinely proactive governance. Stay with me, we will discuss this through a scenario in a bit. In clinical trials, the culture challenge is real. Pharma has been a conservative industry. Clinical Trials Arena described adoption challenges as an inherent feature of an industry that historically moves slowly. But 80% of sites are now using some form of digital tools. The shift is happening. I have created this PDCA cycle on this slide. Plan, do, check, act is your culture engine. It's not about wholesale transformation. It's about identifying one small improvement per sprint. Kaizen moments, as they're called, meaning identify one process improvement. Over a 3-year trial lifecycle, small compounding improvements become a completely different operating model. Give your team permission to call out process issues. Celebrate wins at every retrospective. Track velocity, not to punish slow sprints, but to understand what's causing them. That's how you build a team that runs better studies, not just faster ones.
Let's test our knowledge through this scenario. Anita is a clinical trial PM running a phase 3 oncology study across 18 sites in 6 countries. At week 8, only 7 of 18 sites are activated. The leadership is concerned. Enrollment targets are at risk. The traditional monthly reporting cycle has masked the problem for weeks. Now watch what changes when Anita introduces Agile in week 9. Daily stand-ups with all country managers and CRAs. 1 Jira card per site per task. Blockers visible within 24 hours. In 3 days, she knows exactly what's stuck. 5 sites waiting on contracts, 3 on IRB resubmissions. She runs a focused 1-week sprint with a single goal. Regulatory and legal teams join the sprint. CRAs escalate directly, not through a chain of weekly calls. Jira burndown shows progress daily. By week 12, all 18 sites activated, 4 weeks ahead of the revised forecast. No more activation delays. And at the retrospective, the contract templates were found to be the root cause. New SOP to pre-approve contracts at protocol design stage embedded into the next study. The problem never recurs. That's not just operational improvement, that's institutional learning. That's Agile working exactly as it should. Agile is not a silver bullet, but it does help clinical trial teams be more adaptive, more responsive, and more in control. Start small. 1 stand-up, 1 Jira board, 1 retrospective. Build from there. I've added all the references used in this video in the description box below, so go check those out if you'd like to dig deeper. If this has been helpful, drop a comment. I'd love to hear how you're applying Agile in your trials. Share it with a colleague who needs to hear this. And if you haven't already, like, subscribe, and I'll see you in the next one. This is Miss Brown, simplifying clinical trials project management. See you soon.